Good afternoon, everyone, and welcome to this EHMA webinar. We are just waiting for a few of you to connect. We're seeing the number of participants growing, so we'll just give 30 seconds for you to get situated, and then we will start with this webinar. I see the number are still growing, so we're just waiting a couple more seconds. Perfect. I think that we can start this webinar. So once again, good afternoon, everyone. Welcome. Today's event is titled Building Competencies in Healthcare, the Future Role of Women in Management. This webinar is co-organized in collaboration with our members, ALTEMS, that is the Graduate School of Health Economics and Management at the Catholic University of Sacred Heart in Italy. My name is Federica Margheri. I'm the Chief Operating Officer at EHMA, and I will be the facilitator for this event. So today's webinar is all about competencies in healthcare, and it has a specific focus on the role of women in health management. So just to guide you through the agenda for today, so you will hear from me just for another couple of seconds with the opening remarks, and then I will pass the floor to Dr. Irene Gabutti and Dr. Federica Morandi for their presentation on building competencies in healthcare. And basically, they will present the findings of their research. There will be the chance for you to ask your questions, so please do feel free to use the Q&A box. And then we will have a presentation of the new international master course organized by ALTEMS, whose modules are really built on the findings of their research on competencies. So our speakers today are Dr. Irene Gabutti, Dr. Federica Morandi, and Professor Cicchetti. Thank you all very much for being here and for sharing your knowledge with our audience. Before I leave the floor to them, just a few more words about EHMA. So our vision is excellent health management for a healthy Europe, and we do so by supporting the spread of knowledge on effective health management. We do so in respect of our values of excellence, quality, relevance, respect, and inclusiveness. We are the only membership organization in Europe to bring together the whole health management ecosystem. We're an amplifier of best practices, and we really provide an environment where evidence is valued, but also experience is valued, and we really allow for complex debate to take place. And certainly one of the platforms that we provide for this complex debate to take place is our annual conference that is going to be from the 5th to the 7th June in Rome, co-hosted by ALTEMS. So we strongly encourage you to submit your research. We need you to shape the health management agenda, and we look forward to seeing you in Rome. So without further ado, I would like to give the floor to our speakers for today. I am very pleased to introduce Dr. Irene Gabutti. She is adjunct professor at Catholic University and senior researcher at ALTEMS. And we also have with us Dr. Federica Morandi, who is assistant professor and director of academic programs and research at ALTEMS. Irene and Federica, I leave the floor to you.
Yeah, thank you.
We're getting ready. Just a moment to share.
No worries, just take your time.
Okay.
Here we are. Is it okay?
It's perfectly visible and we can hear you very well. So I leave the floor to you.
Okay, fantastic. So I will take the word first. So first of all, thank you very much, Federica, and thank you to the whole fantastic EHMA team for hosting us in this event. We are very excited about not only presenting our some insights of our research to your network, but also to tell you a bit more about our school here in Rome, which will host the next EHMA meeting. We're very excited about this. I will start this brief presentation telling you a bit about one of our main research streams, a topic that is very interesting for us here in ALTEMS, but probably for most of us scattered around the world. I will introduce an international project we're following. I will then give the word to my colleague, Federica Morandi. This should be moving. Oops, okay. Great. Who will tell you about a national study we have carried out in ALTEMS, and then we will, as you were saying, give the word to Professor Cicchetti, who will tell you about our brand new master course in healthcare management here in Rome. Thank you, Federica, if you help me, that's fantastic. About this research, well, we are speaking about competencies and career ladders of female managers in the healthcare sector. We probably are all quite familiar with the issue we are facing. We know that females globally in the 21st century face unequal promotions compared to male colleagues. We probably all have heard about the term or the expression glass ceiling, which is a complex matter, which basically consists in a transparent barrier. Although females are clearly competent and willing probably to cover managerial positions, there seem to exist a number of transparent and not so clear phenomena that tend to make this advancement a lot more difficult than for male colleagues. What do we know about the employment of females globally in general? We know that, of course, labor force is made up in great part of female workers. And we also know that recently, although this may sound counterintuitive, the employment gap has decreased. And when I speak about recent years, I'm mentioning the COVID years. We may have expected that the gender gap in employment may have increased during COVID, the years of COVID, due to the extraordinary burden that most women may have experienced in these 2, 3, or 4 years. However, indeed, the gender gap in employment has decreased globally from 11.7 to 11.3%. Yet, this doesn't mean that females are covering, let's say, managerial positions in equal terms than male colleagues. Indeed, just 18% of firms globally are led by females, and just 22% of board members are females across Europe. So the gap in, let's say, managerial positions is still very high. And what happens in particular in the healthcare sector? Well, a very worrying, perhaps, phenomenon takes place in this sector, because we know that around 77% of the health workforce is made up of females. So if you have a look at the lower part of this slide, you can see that 75% of workers in hospitals are females, 77% in the healthcare sector are females, 84% in social assistance sector is made up of 84% of females, yet only 38% of females has a managerial position in this sector. So 1 out of 3. This gap is extremely evident. No, we would expect a different pattern in this sense. No, I wanted to go back, sorry. Okay, so why is this glass ceiling taking place? Why is this happening in general and in the healthcare sector in particular? Literature suggests that there may exist 3 main pillars of reasons why this managerial gap is taking place. The first is possibly due to the difficulty of combining clinical, leadership, and domestic roles within in female managers. So possibly the private life of females make it more difficult to combine everyday responsibilities with their clinical and leadership responsibilities. A second pillar of reasons may be due to poor career management. What does this mean? This means that the way we build, design, implement career ladders is possibly more tailored to male colleagues than to female colleagues. And third, last and definitely not least, a reason why this gap takes place is possibly related to gender-related stereotypes, unequal career opportunities, and pay gaps between genders. This being said, this introduction being our, let's say, context, if you will, we have now very little time, but we would like to tell you a little bit about a large research project we have carried out in the past 3 years together with the International Hospital Federation, which is a broader project. And we will just now mention a few insights, a few interesting points on which we would like to think about in the next months in our research. Let me just mention very quickly what the main research was about. You might know the International Hospital Federation. You might have heard about its clinical directorate, which is a list of relevant managerial competencies grouped into 5 main domains, which you can see in this slide. We have picked out a number of particularly relevant and updated competencies from this directorate, and we have administered online a survey to hospital CEOs worldwide. We have explored their anographics, general formation, their training pathways, so what kind of university studies they carried out, what kind of post-university training they have carried out, their career pathways, and then also an assessment of the relevance of the competencies we have picked out to cover the position of a hospital CEO, as well as a self-assessment of their competencies. This was, as I was saying, a broader study. It was not necessarily just oriented to explore the gender gap, but we have also carried out this sort of reasoning within it. So just a few words on some of our broader findings. Not so surprisingly, perhaps, we can see that 67% of the survey is made up of males, so females are a minority. If we look at their career ladders, at the career pathways, we can see that they are quite similar, meaning that they're mostly developed within the healthcare sector. They are mostly developed within the hospital sector in particular. Let's say different kind of careers are less frequent. But what is interesting to see is the last part of the graph on the right, where you can see a big gap between the light orange and the dark orange pillar, which suggests that, for example, females compared to male colleagues are less inclined to working partly in the public sector and partly in the private sector. So it is more frequent for men to develop their careers in part in the public sector and in part in the private one. So this, for example, is an interesting point of view to understand why this is and what sort of consequences this could have in terms of, for example, competencies. So let's have a look at the perceived relevance of the competencies as assessed from hospital CEOs while covering their role. You can see that the patterns are similar. The 5 domains we have clustered are leadership, communication and relationship management, professional social responsibility, health and healthcare environment, business. You can see that the dark red, which means that this competence, this cluster is highly relevant, is, let's say, the part of the graph that takes the major space. And the patterns we can see across the two, let's say, the 2 genders, so females first and males later, are similar. However, we can see that they are greater in percentage terms for females. This means that females tend to consider as more relevant, as more frequently highly relevant, the competencies that we have presented in our survey. Nevertheless, if we go and have a look at the perceived self-assessment, the self-possession of the competencies, we see that the percentages are a lot more similar. So the patterns are still the same. So professional and social responsibility assumes a very big part of relevance, as you can see, but the percentages of the highly present and high level between females and males are indeed very similar. So what does this mean concretely? This means that we have assessed, we have found that females tend to have a higher gap between the importance they give to competencies, to many competencies that are in this list, and the degree to which they feel confident in their possession of them. This list of competencies, basically the red part shows us those competencies in which we feel, the respondents feel, that there is a large gap between how important they are and how much they possess them. And you can tell easily also just visually that this gap is much larger for females than for male CEOs. So to quickly conclude, we found out that gender may affect choices on the type of organization and specifically on the type of careers that are followed by professionals. Preliminary results suggest that the gap between desirable competency mixes and self-assessment are larger for women than for men. In particular, communication and business skills, these two clusters, are felt as the most problematic, meaning that the gap tends to be larger, and training programs should probably focus on this swiftly. And finally, though the role of women in healthcare management is studied under many perspectives, the glass ceiling is indeed on our research agendas. We are aware, we think, that there are many, let's say, issues that we still do not understand. So indeed, for example, why do women follow different career ladders than men to some extent? And how do they behave differently while covering top managerial or middle managerial positions? And with this, I hand on the word to my colleague, Federica Morandi.
So thank you, Irene, and good morning for everyone, and thank you for joining this webinar. It's a pleasure for me to be here. And my task is to switch to our national study that we have performed here in ALTEMS. And first of all, it's useful to define the main aim and the background of this study. As you well know, in healthcare, there are actually a number of different professionals covering the middle managerial roles, nurses, administrative profiles, physicians. However, in the Italian context, the managerial positions, such as the clinical directors roles, the head of ward units roles, are still covered exclusively by physicians enrolled into these managerial roles. They act as hybrid roles, in the so-named hybrid roles, with a number of consequences in their working life, because they have to act as doctors and as managers at the same time, by facing both clinical and administrative managerial tasks at the same time as well. During the pandemic, that is the period in which we have collected the data that I'm going to show you, all the healthcare professionals have experienced a very challenging and stressful situation. In particular, those who were enrolled into the managerial positions, because they needed to decide about resources, staff, human resources, beds, DPI, and on the other hand, of course, they needed to manage the unknown virus and all the negative consequences on their patients. For these reasons, we decided during the pandemic to assess some behavioral traits of doctor managers, especially traits related to the resilience, in order to understand the individual resources, but also the possible patterns of development for the careers of this managerial profile. The reason is based on literature, because according to the evidence provided by the scientific debate, we know that in presence of the same amount of knowledge and the same amount of skills, the behavioral competencies can make the difference. So it is very important to study and to understand the behavioral patterns of middle managerial roles, and in particular of doctor managers. As you can see in this slide, we use the definition of resilience as the dynamic process encompassing positive adaptation within the context of significant adversity. This is just one of the possible definitions of resilience. And as you can see, our sample is composed of 115 people, of which 43 female and 72 male. For the purpose of this workshop, we decided to compare the two genders in order to provide evidence about the characteristics of women staffed into managerial positions in healthcare. Here we can find some interesting evidence. In the left side of the slide, you can find the age of our sample, and you can appreciate that women are present also in the younger ages, while in the older ages we can largely find just men. It means that in the past the phenomenon of the glass ceiling was probably higher than actually, and it is more or less in line with which we have discussed before. In our sample, the majority of the interviewed physicians are in the area of services, for example, public health, microbiology, legal medicine, as you can see in the right part of the slide. And in terms of possess of an academic positions, both women and men are very similar, while the majority, both of male and women, have attended a managerial course. However, when the answer is no, the number of male who have not attended the managerial course is higher than women. For a managerial course, we intend Master of Science or other specialization courses that can allow to doctor managers to acquire all the managerial skills and all the managerial knowledge that are useful to better perform in their task, in their role. This evidence about the significant difference between men and women in terms of possession of this managerial certification is also confirmed by our statistical analysis, in which you can see that the p-value for the attended management training courses is significant. Here instead we can find the main results of our survey. And specifically, you can find the questions that we posed to our sample, divided for female and for male. And although the differences are very light, we can observe that male would disagree with the items, so that basically who show a lower degree of resilience are more than female. I mean the pink part of this graph. You can see that in the male sample, the pink part is lightly higher than for the female. And in general, the responses of women are higher than those of men, confirming the wide debate about the topic of resilience, because literature widely affirms that women are more resilient than men in general, because they have to combine multiple tasks in their life. They have to combine the private life with the working life. They have to take care about kids, about parents, about in-laws, about a lot of people. So in the time, they develop a higher level of resilience in comparison to the men. In this sample, we have not a significant, statistically significant difference between the two genders, but in general, we can observe by a descriptive perspective that female are likely higher than male. So let's move to the following result. This is a correlation matrix in which we tried to correlate all the items of our questionnaire, and we tried also to correlate with the specific dimension of the age, which is the light purple column in the right side of the graph. For women, there is not a significant correlation between resilience and age. It means that these two variables are independent. So independently from the age, women are resilient or not. Instead, for men, which is the right part of the graph, we can see that for two variables, flexibility to change and also the item when I am under pressure, I can maintain my attention, we can find a negative correlation. It means that the higher is the age, the lower is the flexibility of men, and vice versa. And the higher is the age, and the lower is their ability to maintain the attention when they are under pressure, and vice versa. In this following slide, we can see the statistical analysis that we performed on these items in order to check for a significant difference between the two groups, men and women. And we found just one item having to deal with stress as strengthening me, which is statistically different between the two groups. For all the other items, there is not a significant difference, and it means that it provides a very strong signal that there are not specific behavioral conditions that can limit the career path of women. This data evidence that both the groups are very similar in the management of stress, in the management of emergency conditions. So it means that if we consider the same amount of knowledge, the same amount of skills, and in this case also the same amount of resilience, we cannot find a scientific explanation for the glass ceiling. This is the topic of our webinar, so this is the evidence that we can provide with our data. So just to arrive very quickly to the concluding remarks for the specific part of the national survey, we have observed that in terms of resilience, women in healthcare who possess a managerial position show higher scores of resilience than men. More specifically, the correlation analysis showed that the gender and the age are negatively correlated for men, and instead for women, age doesn't matter in terms of resilience. And finally, that we couldn't find a real difference between the two roles, the two genders, and it implies a very strong recommendation for policymakers and for managers that men and women are exactly the same in under stressful conditions and in emergency situations. Of course, our study, the Italian study, has some limitations. We have a limited sample, of course, but we are working on collecting more data, and it is our intention to provide more evidence about that in the very near future. So thank you again for your attention, and I think that now is the time for the questions.
Indeed, Federica, and thank you, and thanks, Irene, for this very interesting presentation. I would even say that there wasn't a more timely moment to have these webinar on competencies, because yesterday was International Day of Education. So no better time than today to discuss about how to build competencies. I would like to invite the audience to use the Q&A box on your screen to ask your question. Alternatively, you can use the raise hand option and we can bring you on the screen and you can ask your question live. While you decide how you want to ask your question, I can already ask you, Federica and Irene, a question that comes from the chat from Emmy Weller. Emmy says, thanks for presenting these interesting data. Do your studies have any insights on possible strategies to address the gap of women in leadership roles? So Amy really ask the question.
Right. Well, thank you for the question. As you say, it's the question
Indeed.
that nobody would like to answer, at least it's not so easy to answer. Indeed, yes, of course, the whole point of our research is trying to translate, is of course to, let's say, contribute to the scientific knowledge, but also to translate these data into concrete actions. Of course, here we are a training school, so our part of the job is to adapt our training programs to the gaps we were mentioning before, and to the, let's say, possible redesign of career ladders in ways that are more similar to the needs of female leaders of today and of tomorrow. Of course, the matter is very complex. Of course, those 3 pillars of, let's say, barriers to a smooth progression in career ladders of females are difficult to address. They involve many actors that are not only, let's say, research centers or training centers. No, they have to do with, you know, cultural matters, political matters, social matters. So the path is long, but on our side, what we are trying to do is we're really trying to transform our way of training in ways that are oriented to cover this gap and to, let's say, respond to the needs of a big and hopefully always larger share of managers in the future. I don't know, do you want to add anything else?
No, thanks.
Okay.
It's okay.
So there is a question from Gabi Egger, I hope I'm pronouncing the name correctly, which is about details of the study. So when did you gather the data for the study? Which year?
Is she speaking about the international study? Well,
let's go for both.
So as for the International Hospital Federation study, we started gathering data in 2020. We collected data from 15 countries, and for now the updated version is from over 400 repliers. The data we have presented here is not quite the last version, so it was already of a few months ago. But yes, it was in a long span of 3 years' time. And we are currently still collecting data. By the way, if there are any hospital CEOs following us, please get in touch with us, or researchers willing to connect us to hospital CEOs.
Yeah. Instead, for the Italian context, we collected data during 2020, and we still are collecting data, but now we are collecting them in a retrospectively perspective, because the first round of data collection was made during the COVID-19, because we wanted to assess a number of behavioral traits, comprising the resilience, and in that period, the topic of resilience, stress, and challenges situations was very, very common. So this was the period of our survey.
We also have some questions about specifically the national study. So Domenico Sorrentino asked, did you find any territorial or regional differences among the main causes of gap between men and women at national level?
Okay, thank you. It's an interesting question. We still didn't check about the regional differences, even because we basically we collected data mainly in the Lazio region, which is the region in which we work, and also in other regions in the neighboring area, since the first data collection was performed through our direct connection with people and with the previous students of our Master of Science. But it is a very interesting question, so we will check it probably in the next step of our study.
Thank you very much. And then still it's connected to the national study. An anonymous attendee, so I can't read the name, says, thank you for the presentation. I found the Italian study extremely interesting. Do you have any insights from other countries? Do you foresee similarities at the European level?
It's another very interesting question. Actually, no, we have just explored this phenomenon in Italy, but we are trying to find connection with the Irene study in order to find some point of comparison and connection also with the other countries. There is a very wide literature about the phenomenon of COVID resilience, mainly in healthcare. So sure, we can compare our result with other evidences provided by other countries, other scholars, but it is a very interesting point, and we are working on that. Indeed.
And so they're full of questions, so I'm going to keep asking them. So a question from Zachary Desson, looking at the data about self-reported management competences, it seems that there is a large confidence gap between male and female professionals. Do you have any insights into the social or systemic driver behind this, and what can be done to address them? That is another question with capital Q.
I get all the difficult questions.
Yeah, indeed.
No, indeed, it is the gap is different between males and females. In this phase of the study, to be honest, we are detecting it. The next steps of our let's say work will be to understand why this gap takes place. I went very quickly, so it's understandable that I was not clear about this, but the study indeed is much broader. So what we will be doing in the next months is trying to connect a number of items belonging to the training pathway, the career pathway, and personal characteristics of professionals, as well as the geographical area in which they work and live, to the gap and to the self-assessment of competencies, to try and determine whether some types of career are more useful, let's say, to reach specific mixes of competencies. And we will, of course, control by gender. So this is one of the next steps. I hope to meet the attendee again in a few months and answer more exhaustively.
Well, thank you so much for the initial answer. And then I think a last question also, because we are close to the end of our time for Q&A, which I would say is a difficult one. So we'll address it to both, Irene, just to make sure that you both get. So it's from Evelyn Donahoe. It says, that has been very interesting. And she's asking, can you tell how you think organizations like EHMA, and I personally would like to extend it to also other professional or international or European organization, can support women break the glass ceiling in the workplace?
Okay, I think it is a fundamental role that EHMA can play, because EHMA has the, let's say, opportunity to go and tackle all of those, pillars we were mentioning in the first place. And one of the most, let's say, hard to address is possibly connected to our culture, organizational culture and social culture in general. And an opportunity, let's say, a platform like that of EHMA is a unique opportunity to put people together, discuss topics as we're doing today, put together in the same room people with different experiences, listen to each other and learn from each other. And the real, I think, obstacle, this is what I personally think, to covering this gap, more than just adjusting, which is of course very important, training pathways and reshaping career ladders on new needs and so on. The real obstacle is probably cultural, and this is where you are very powerful, in my opinion.
Yeah, I agree with you.
Good.
So Federica, do you want to add anything, or?
No, I think that Irene, it's a very It's been
Convincing.
very clear, very convincing. Yeah.
Okay, great. Well, thank you both very much for sharing the results of your research. For the next part of the webinar, I would like to invite on the stage Professor Americo Cicchetti, who I believe is connected. No, he's there. Okay.
We are all together.
Yeah.
We are all
Perfect.
together.
Well, thank you very much
everyone.
for being here, Professor Cicchetti. So Professor Cicchetti is a full professor and director of ALTEMS. He's also director of research of the Health Technology Assessment Unit at the Gemelli University Hospital in Rome. He's also a member of our Scientific Advisory Committee and a long-standing member of EHMA. Professor Cicchetti, you are here and we have introduced that you will present the new master on management in healthcare and life science organizations that ALTEM has built based also on the results of this survey. As a way to introduce these presentation of the master, I wanted to ask, I know it's a big question and clearly it's just a way of introducing, but from your experience as a director of ALTEMS and your previous experience, what do you think are the main skills needed in health management, and how can the master that ALTEMS has prepared help build these skills?
At first, thank you very much, Federica, and to you also with thanks to EHMA for this opportunity. I followed the presentation of this project from Irene and Federica, and actually this is also our approach to design the contents of any master program here in this school, that actually is a bit peculiar because it's a joint effort of the Faculty of Medicine, the Faculty of Economics. We have collaborations with our Faculty of Psychology that is based in Milan, and this is needed because, of course, the competences that are needed to have a good performance as healthcare manager, of course, are not only technical, as we know, but are comportamental, and actually they are evolving over time. We have followed all the, let's say, the impact generated on healthcare systems of COVID-19, and COVID-19 has brought really the need of new competencies. We, in the past, were thinking about the importance of being resilient, not only systems, but also people. Now we think that what is important is to be anti-fragile, because we need to, to cope with a new scenario that is dramatically changing and is bringing crises over time. So crises will be part of our activity as the natural environment to look at and to work with. And so also this program, this new program that we are launching is investing a lot on the development of such behavioral competencies, beyond, of course, the typical technical ones. I would like to leave now the floor to Irene, that is coordinating this program, to give you some details. I would like just to add one point. This program is trying to capture the complexity of the health sector. And so we are looking at healthcare organizations, health systems, but also we are considering life science industry, because we think that this is really an ecosystem to be managed. And the common language between those that are managing healthcare organizations, that are managing industry in this field, is quite evident and important. So on the basis of these general concepts that we have designed the program, and we are happy to share with the colleagues from EHMA these ideas. So thank you very much for this opportunity. I leave the floor to Irene. Thanks.
Thank you, Professor Cicchetti, for being with us.
Okay, so I'm back. Surprise. Not expected, but I'm back. We will just share the screen again.
Yeah.
Thank you, Federica, for your help.
Just a few moments. I have to.
We're getting there.
Yeah, I'm trying to.
It's normal
yeah.
that things don't work when it's urgent.
Yeah,
it's normal.
Yeah.
No worries. If there is any problem, we have some technical support in the background that can put up your slides if you want.
I'm just trying to share my. I find.
Okay, super.
Okay, perfect. Here we are.
Great. So yeah, I will be presenting you this master course. But before, let me just spend a few words on ALTEMS. For those of you who do not already know ALTEMS, this is the Advanced School of Health Economics and Management, which is part of the Catholic University campus of Rome. We work in a strict connection to the Gemelli Hospital, which is one of the largest university hospitals in Italy. And ALTEMS has a 15-year experience by now in training professionals in the healthcare sector through master course and what we call high specialization courses. As Professor Cicchetti was mentioning, we believe that our main strength is in our multidisciplinary approach. We are a multidisciplinary school. We are Faculty of Economics, but we are joined to the Faculty of Medicine. And our courses, our faculties, our students come from a broad range of backgrounds, which means that our courses are characterized by speaking together. This, we believe, is really our major strength in training professionals that have the opportunity and an ability to develop their multidisciplinary competencies. Well, this is an international master course. It is our first program that is wholly delivered in English and is open to international students as well as to international faculties. We believe that it is strength to come and study here in Italy, because for those of you who do not know the Italian healthcare system, it is indeed considered among the most successful healthcare systems worldwide, with high quality services while guaranteeing access to services to the entire population in a welfare state. This is let's say, an interesting context because we are located in Rome, which is one of the, let's say, major hub entities of our countries in our hub and spoke networks. So we as Professor Cicchetti again was mentioning before, we believe that our, let's say, programs are in a very interesting environment, which we can, let's say, use to some extent. We have, internships and case studies from the real world coming from our natural environment, but we are also, let's say, oriented to developing updated competencies in the light of the major turbulence and challenges our sector is facing in this era. So as you can read in the slide, the main competencies we want to develop are the managerial ones, the behavioral ones. We would like students to understand the current trends of change of the sector, which are in part local, but in very large part global. It is quite surprising to see how similar the challenges of a hospital, of a local health unit, of a private nursing home must face planet-wide. We would like to develop competencies on how to drive technological innovation. We know this is a sector in which technology plays a great role, very expensive technologies. So the idea of investing in technologies which are then not effective is very scary. We cannot really afford not to implement technologies in optimal ways and achieve the intended performance through them. We would like our students to learn more about the best managerial practices around the world, but also learn how to, let's say, work in jointly with partners around the world, both by creating networks and also both through the development of research skills and, let's say, joint research efforts. The master course, very quickly, is oriented to professionals already working in the healthcare sector, covering either middle management position or aiming to cover one. And in the healthcare sector, this means hospitals, governmental institutions, biotech, everyone, really everyone, because our approach is really multidisciplinary. And the program also will host a limited number of graduates, of younger students, who are willing to enter the start a career in the sector, and will have the probably quite unique chance of working jointly and studying jointly with professionals who are already in managerial positions. Okay, so just very final remark, this is our program. You can find it on our website in case you are interested. And this edition of the master course will start in March already. It is built around 7 modules. The first and the last are in presence in Rome. So this means that at least twice we would really like to have you here in Rome with us in case you are interested in attending the program. All of the other modules are online and so can be followed at home. Lessons will be from Monday to Friday, and we will have, of course, front lessons. But as we were saying, this is a modern program, so we believe a lot in let's say, integrating programs with case studies, practical laboratories, and group simulations. So I hope personally, since I coordinate this master, that it may be interesting for you. Yes, thanks, Federica. And of course, if anybody has any further question, we are happy to answer now or by email or by phone.
Well, thank you, Irene. Of course, if you are happy, we will be sharing your connection details for the master, and so our participants can certainly get in touch with you and get in touch with ALTEMS for more information. As a short reminders to our participants that the slides from the research will be made available on our website, and so will be the recording of this webinar. So in case you miss it or in case you want to share it with colleagues, please do feel free to go on our website, which is EHMA.org. So we are at the end. I really would like to thank you, all the 3 of you, Dr. Irene Gabuti, Dr. Federica Morandi, and Professor Americo Cicchetti, for your time, for sharing these insights. Just one last reminder, we are looking forward to receiving your research for the EHMA 2023 annual conference, again, co-hosted by ALTEMS. So you will be able to see Dr. Gabuti, Dr. Morandi, and Professor Cicchetti again. Submit your research. Yes, submit your research. You have time until 6th of February. You can find all information on the website, ehmaconference.org. I look forward to seeing you in Rome. And once again, thank you to our speakers for being with us, for sharing your knowledge with us. And to all our participants, thank you for your time and see you very soon. Take care. Bye-bye.
Thank you.
Thank you, Federica. Thank you.
Bye.